So I'm forever learning from my patients, and a lot of times the biggest thing that I have to say is doing more can sometimes be the worst thing for the patient. Rephrasing it, the best thing you can do for the patient is nothing. I was encountered with a patient that needed open heart surgery, needed multiple different forms of open heart surgery with fixing the artery, with fixing the valves. And he said no. He said, my quality of life is so good right now that I'm willing to take it, even knowing that I only have 3 months of good quality of life versus the uncertainty of having open heart surgery and then having to deal with the recovery of open heart surgery. And I absolutely agree with him. Had he been 20 years younger, I think I would 100% tell him to go for surgery, but older age, more complications, more risk of complications. Sometimes doing less is more. And the biggest reason for this decision that was made was because he was feeling good. We found this when we were trying to work him up for something else that he needed to have surgery for. So he needed a pre-op evaluation, and part of that evaluation involved looking at his arteries. And that's when we found multiple blockages, and not just blockages in scary locations. And then we found that he had a leaky valve, a couple of leaky valves, and one needed to be fixed if he was going for another surgery. So we were going to do this, do that, do this, and we finally just stopped and just looked at the grand scheme of everything. Older age, but he's doing well. Got to see daughter graduate from college, get married. Got to see grandchildren, and now has seen great-grandchildren. And that's when we decided that sometimes less is more. And I'm learning each and every day from my patients, but I'm also learning the art of medicine, because there's so many things that we can fix, but the biggest question is, should we try to fix it? You know, one of the things I always tell my patients is, if it's not broken, there's nothing for us to fix. And though he has a lot of things that we can fix, he's not having pain. He's active. And will we, by trying to fix it, ruin that? I'm just want to know people's opinions. Like, have you been faced in a scenario where something similar has happened and you chose one way or another, and what the outcomes were, whether it's for you or a close family member or friend? I believe we learn through experiences, but also learn through communication and dialogues. And this is a great one to have. Being aggressive and trying to fix something versus being less aggressive and sustaining the good quality of life that they have, that you have. My name is Dr. Isang, and if you got any benefit, leave a comment, share your experience. Thank you.